Good afternoon. I'm Becky Wittes, Chairman of the Niagara County Legislature. Thank you for joining us live on LCTV for our Niagara County COVID-19 update today on Saturday. You can also catch us live on lctv.net or by linking to the YouTube channel through our county Facebook page. We're also currently live on 90.9 FM. Let's start right out today with our updates for Niagara County from the Health Department. Since we reported on Thursday, we have had another 28 new positive cases of COVID-19 in Niagara County. That gives us a total of 194 to date. The good news is we have no new deaths to announce today. We are still at the 4 that we announced previously. Our Niagara County heat map has been updated. You can go on the niagaracounty.com page. At the top of the page is a banner for COVID-19 information, and you will find a link to this Niagara County heat map that breaks down the positive cases by municipality, so you can see what towns, cities, and villages those are located in. We've also previously told you about a new New York State map, which is posted on the state website. Again, there's also a link on our niagaracounty.com page for you to access that state map that breaks down all of the counties in New York State, gives you a little bit more data that you can look into. One of the pieces of data you can find on that state map is the number of tests that are being done in each county throughout the state. According to that website, Niagara County has now performed 788 tests in Niagara County on our residents, and we're seeing roughly about a 20% return as positive tests on those that are being done. Now, keep in mind, of course, with a population of about 216,000 in Niagara County, that amount of testing is still very small. However, that's based on the availability of tests. We've said time and again that we are just not getting as many tests out here in Western New York as we would like to have for our residents. But we are seeing a collective rise in those tests, collectively through the health department, but also private doctors' offices and hospitals in our area. As we do more tests, of course, we will see an uptick in the number of positive cases that are coming back, and we certainly expect that. People talk about surges in positive tests and when we'll see those peaks. And of course, it's very hard to say when we've hit that surge until we have enough data, enough days in a row to see that information after the fact. We are consistently seeing double-digit rises in our positive tests day by day here in Niagara County, and of course still seeing more positive tests across New York State. But the governor told us again today that based on the models that he's using, that they are seeing that flattening of the curve. Hospitalization rates have been down. Of course, the number of deaths is still very large across the state, but that again is to be expected as individuals who have been on long-term ventilation reach the end of their COVID fight. So we will, of course, continue to see those deaths even though the number of new cases does appear to be flattening. Again, because we're still seeing those positive cases on the rise, we do feel we are slightly behind what's happening downstate as far as our numbers. We have to remain vigilant. New York State on pause is still very much in effect. We still have to follow those guidelines all across New York State and here in Niagara County. Keep up your physical distancing. Everyone asks, when will work reopen? When will I go back to work? When will the schools reopen? When will the businesses reopen? Unfortunately, at this point, as the governor said again this morning, we just can't give you that date. It is purely speculation at this point, based again on what we're seeing in the numbers, and of course not wanting to create a second surge in those positive tests by sending people back too soon. So we can't say enough. Please, again, continue to follow those guidelines. Stay at home and stay safe for your family and everyone else in the community. To that end, the governor did give us some further clarification on some of the essential versus non-essential businesses. And we have now been told that golf courses, boat launches, and marinas are now deemed non-essential. Previously, the Niagara County Golf Course had been opened. We were, of course, following all of the physical distancing guidelines that we could. Tea times were by appointment only. There were no carts. Ball washers were covered and not being used. There was no pulling flags and so on. But at this time, to comply with that new order by the governor, the Niagara County Golf Course is now closed at least through the end of the month, which is the date that the governor has extended New York on pause until April 29th, of course, to be reassessed as we go. Also, the disc golf course, Frisbee golf, is closed at Burmaster Park as well. Very important to follow those rules. We have those parks open still so that families can get out and safely get exercise and hike. But again, we encourage you, please, to follow the guidelines of physical distancing. If you're out on the trails hiking and you run into people you know, please don't stop and chat, wave hello, wish them well, and keep on moving and keep yourself safely distanced. We know that there have been many social consequences involved with COVID-19 and the fact that people are having to stay home and away from their friends and family. It can be very hard emotionally to go through that process and to have to distance yourself. We've certainly talked already with our mental health director, Laura Kellerman. We've talked to our district attorney, Caroline Wachasik, about the increase in domestic violence cases during this time. But another issue that, of course, is near to me, as chair of Niagara County's Opioid Task Force, I was very concerned recently to hear from Sheriff Filicetti that our overdose dispatch calls to his office during this time frame have increased by 35% over what they were the same time period last year. Now, we certainly will have to do much more social research to confirm the connection between these overdose rates increasing and the COVID-19 crisis, but it certainly makes sense to me. People are feeling socially isolated. They're having to stay home. There's fear and anxiety that's involved for all of us, and that face-to-face support that people might normally have for substance use disorder might not be available. The face-to-face isn't available at this time. We know of community organizations and support groups that have either chosen to or been forced to close down due to COVID-19. Many of those organizations are trying to hold teleconferences with their clients. They're reaching them by phone. Even some of the support groups have been able to meet by things like Zoom and Skype and all of those other teleconference and video conference uses that we have these days, which is wonderful, but not everyone has access to those or is willing to do that. So again, I just want to remind everyone who's out there who might be struggling, or if you have a family member who is struggling with this, please don't hesitate to reach out to our Mental Health Crisis Services line for Niagara County. That number, 285-3515. They're there 24/7. It is free and confidential help for you if you are struggling at this time, whether it's substance use or some other issue that you're having that you just need someone to talk to and connect with. Please reach out to that crisis services line. Again, it's 285-3515. You are not alone in this. We are all struggling in some way, and they are there to help with that. Now, Easter weekend, we have, of course, Holy Week, Passover, tomorrow is Easter Sunday, and this looks very different this year than it does, of course, from any other year for all of us. It's difficult. We all want to have those big family gatherings, the Easter egg hunts. Many individuals go to church on Easter Sunday and want to be with their church community to celebrate and to pray. But we can't forget at this time that we really have to, again, use those distancing guidelines and stay home and keep not only ourselves safe, but maybe the members of your family who are the more vulnerable community that you don't want to bring that home to. We also don't want to cause any more increase or work for our healthcare or first responders who need to be out each and every day handling these crisis matters and their regular day-to-day jobs as well. So again, we ask that you find new ways to connect on this Easter weekend. I know many families who are having big family dinners by Zoom. They're all going to connect through their computers and share a dinner together from a safe distance. Take 5 minutes. We've heard New York, Take 5 for New York is the initiative that's out there. And really this is about finding ways to connect. not only with your family that you're close with, your family that you connect with probably each and every day, but take time to think about those neighbors who might be alone, who don't have family to connect with, especially on a holiday that can be very isolating, even in normal times. So please, again, we ask you take 5 minutes to reach out to someone that you wouldn't normally reach out to, or someone that you know might be home and by themselves. Check in on them, make sure that they're okay and doing well. We've also been talking about who you stay home for. A lot of the situation that we're in right now has to do with taking your own individual responsibility in this situation and staying home to help keep everyone else safe. I stay home for all of our Niagara County responders, our first responders who need to be out each and every day, dealing with the public out firsthand at a time when their job is even more potentially dangerous than just a normal day. So again, we thank all of those first responders, and they're the ones that I'm choosing to stay home for. Please pick the person that you will stay home for, again, especially on this holiday weekend. If you missed us today at the beginning at 2 o'clock, you certainly can catch us again tonight on demand on lctv.net. They will replay this broadcast on their nightly schedule on TV as well. We thank all of the other media outlets, local news stations that have chosen to pick up our broadcast and help us to keep our residents informed. And again, of course, to LCTV for the wonderful partnership that we've had with them these last weeks in helping us to really get the information out to our residents. We'll be back with you Monday live at 2 o'clock for our next update. Until then, happy Easter, everyone. Please stay home, stay safe, and stay healthy.